Hi everyone. Today we're presenting our project titled Optimizing Delivery and Determinants of Health Behavior Change in a Cognitive Behavioral Telerehabilitation Program for Hispanics with Chronic Spine Pain, a Rapid Qualitative Study. Physical therapy services are underused by Hispanics with chronic spine pain. There is a need for cultural informed telerehabilitation programs to improve accessibility and relevance of healthcare for underused populations, yet population-specific determinants of health behavior change for telerehabilitation are not well understood. So the purpose of this study was to inform our cultural adaptation of an existing cognitive behavioral-based physical therapy intervention for Hispanics with chronic spine pain by optimizing determinants of health behavior change for a telerehabilitation delivery model. Our participants were 2 females and 2 males. Their age were 24 to 58 years. The preferred language was 75% Spanish. Chronic pain diagnosis, 75% for low back, 25% for neck. The goals intervention, goal stands for goals-oriented activity for Latinos with spine pain, which was a 7-week CBPT telerehabilitation intervention that was adapted for Hispanics with chronic spine pain using the IAM-ADAPT framework. The study was a semi-structured one-on-one interviews that were conducted with patients who completed the GOALS intervention program at a federally qualified health center. The interviews were audio recorded, transcribed, and translated into English. 2 investigators used the rapid qualitative analysis to code the transcripts. Data was then transferred to a data matrix with the constructs and themes based on the IAM-ADAPT framework. These themes were then finalized through consensus with the team. Finally, a logic model for the GOALS telerehabilitation intervention was refined to reflect these themes for determinants of health behavior change. So the findings of our study, for the delivery theme, there were 2 clinical sessions for in-person and 6 telephone sessions. As you can see here in the table, there are supporting quotations that illustrate these themes. We formally invite you to spend some time at our poster session if you want to hear the participants' perspectives in their own words. So the patients were indicated that a hybrid telerehabilitation delivery approach with approximately 45 minutes to 60-minute sessions once a week was preferred. And the in-person helped facilitating the therapeutic alliance and also reduce the fear, while the telephone sessions helped in addressing logistical barriers to improve adherence. Now, for the determinants of health behavior change, the patient's perspectives identified 6 determinants of health behavior change for the GOALS telerehabilitation intervention. And they were therapeutic alliance, self-efficacy, adherence, skills and knowledge, pain catastrophizing, and fear of movement. We used these findings of the qualitative study to refine the intervention logic model, as you can see here, to incorporate the determinants of health behavior change for the telerehabilitation program, as you can see here in the box in yellow. In the future, this model will help inform further adaptations for the GOALS intervention to optimize treatment and outcomes for Hispanics with chronic spine pain, which will be formally tested in an upcoming randomized control trial. And just a quick acknowledgement, this study was supported by SDSU Health Link Center, and a special thank you to our clinical partner. Thank you.